fat is harvested typically from the belly button area called the periumbilical area.
People may not be aware that fat grafting has actually been around a lot longer than filler.
If a patient is older and they're looking for fat grafting as an alternative to facelift surgery, it becomes more complicated.
Can you get the duck lip though with fat grafting?
Yeah.
Still can.
The techniques are similar. The artistry of it, of where to inject, is very similar. Not anti-filler at all. Just want to make sure that people are aware.
Anti-filler.
Yeah, I'm not anti-filler, exactly. Anyway, hi, welcome to Unfiltered. Today we're going to be talking about topics including facial filler versus fat grafting. This is a hot topic. It's been around for a little while. It's been all the buzz on social media. Last year, we've seen actually a decrease in facial filler based on statistics from the American Academy of Plastic Surgery, American Board and Academy of Facial Plastic Surgery. These are current trends. So we're going to talk about, have we noticed this in Canada, and maybe reasons behind this. So I'll turn over to Nancy.
Hi, everyone. So filler and fat grafting are both used very similarly. So they're used to add volume to the face. So you can use it either in the lips, in the cheeks, in the temples, the nasolabial folds, the tear troughs. These are all areas of the face where we could do either fat grafting or filler. Filler has been a very commonly used product. It's a hyaluronic acid product, and it can be used as a temporary solution. So it can wear off usually in anywhere between 9 months to 18 months. Fat grafting is more permanent. People may not be aware that fat grafting has actually been around a lot longer than filler. It's been around since the 1800s. And in the last 10 years, there's been advancements in the technology used to make it more functional in the face. So Dr. Solomon, let's talk about filler versus fat grafting. When do you use which, and how do you recommend it to patients?
So it's a big question. I think it's still evolving. You know, the applications of filler versus fat grafting depends on who you're asking. And, you know, if you're asking a surgeon, they may have one perspective. If you're asking a cosmetic dermatologist, if they don't provide fat grafting, they may not be as aware of different nuances and subtleties.
That's why we like to ask you, because you do both.
I
Therefore,
do both.
You will have a more, non-biased opinion.
Right.
So back at you.
So they're both mechanisms of volumizing. So part of the aging process is deflation. Another part of the aging process is descent. So surgery is lifting to fight the descent. What about the deflation? The deflation is to revolumize. So I always like to talk about history. You touched on the fact that fat grafting has been around a long time. Facial filler, actually, some fillers date back to the 1800s as well. And they were actually using paraffin wax to create some types of volume to the face. And paraffin wax was used, from what I recall, initially for a testicular implant for someone who lost a testicle. They injected this wax into the testicle, which seemed to work somehow. And then they started using it for facial aesthetic use. Unfortunately, there were some complications that took place. And then they started looking at different alternatives. And that's when the silicone trend started. And silicone was used as one of the main filler products internationally for decades, until there were some problems with silicone. Then there was collagen, which was an animal product, which is still available today in some jurisdictions, quite popular. But it got really changed in the industry when hyaluronic acid came on the market. And that's been around since I started practice, for the last 25 years. Hyaluronic acid has taken over the vast majority of the injectable filler market. And there's been different modifications of hyaluronic acid. That's a non-animal based injectable product, almost like a sugar molecule. And the product has been modified depending on how long it lasts, how thick it is, different types of injectables. Some companies are here in Canada that manufacture, many are in Europe and Switzerland. And we've used a variety of different products. So I'll talk about the different products that we've used and our experience with it, and then talk briefly about fat grafting. Another thing I was going to mention to you on the topic of volumization or fixing thing is I was doing a bit of reading, and then it reminded me of something I learned when I was traveling, and I was in a town, like an ancient Roman ruin in Israel. And they showed us a bust of someone, and they said that some of the busts were almost perfect, but some of the busts of these ancient ruins were sort of damaged. And the tour guide said to us that they used to take wax also, and they used to fix broken marble busts. And that made me just think of aesthetic medicine. And they were able to make it look almost perfect with adding in this wax. And the process of wax was called searing it. And they would use the word that if something was fake or broken, it was insincere. So anyway, it was sort of an interesting. Yeah, it was neat. So anyways.
So I'm going to redirect you back to fat grafting.
Okay, so now we'll talk about fat grafting.
He needs a little redirection now and then, folks. Okay.
Okay, so let me just tell you just briefly about indications of injectable fillers. So we talked about it for volume loss, but it first came on the market for filling in folds. Filling in the nasolabial fold or bulking up the lips were kind of the two commonest applications. And then there was an entire school of education that went on within the industry of aesthetic medicine. Where else can we use the products? And cheeks became sort of the next big area. And it really did help modify and enhance people's appearance who were starting to have early signs of aging process to re-augment and blow up the cheek. And they came out with terminology like the liquid facelift, which were a little bit misleading because you weren't lifting anything, but you were volumizing it. And then next it went on to areas like the lower third of the face for jaw augmentation, jaw angle modification. And some patients really benefit from it. You can really do a lot with this product, but again, it has its limitations and its pitfalls. We had recently on our podcast someone who had a weird reaction to a filler product necessitating surgical removal of it. And again, we could talk about that as a side thing. So now we go to fat grafting.
Yes,
so fat grafting as an alternative is something that we've offered actually for over 20 years.
Where do you get the fat from?
So the fat is harvested typically from the belly button area called the periumbilical area. It's also, we harvest from the love handles, and we often harvest from the inner or outer thighs. Those are kind of the common areas, depending on where patients' preference is and depending on the amount of fat that we're able to access. Also, depending on whether the patients had previous surgery in the area. So some patients have had abdominoplasty or abdominal liposuction, meaning that some of their donor fat from that area may not be usable, and then we'll have to use legs. And then once the fat is harvested, we also now have modified our processing system. So I've used a different I've used multiple different processing systems, from something called Pure Graft, which is basically a bag that you inject the fat into, and then you use sterile saline to wash out the impurities of the fat, because there's going to be some oil and some local anesthetic and things like that. So it has a unique system where you're able to wash it out and then just draw back only the fat and leave all the impurities in the bag. So I used that for a number of years. It's a good system. It's from the United States, and I like to use it. So alternatively, another system I use is the alternative is we use centrifuge, which we use for PRP. We harvest the fat, we put it in a centrifuge, we spin it, and it separates out the oils from the fat. Then we take the fat and then we put it through another process where we're able to thin the fat into different size fat globules, from small or to what's called microfat or nano-fat. And then we use small cannulas to inject it. So that's kind of the process.
Can I ask you a few questions?
Sure.
Okay. So some questions that our listeners or viewers may have. Can you take more than what you need to extract a little bit of extra fat? So people often say when we tell them about fat grafting, so can you take a little bit more? Can you take a little bit more, or can you only take the amount for the procedure?
It really depends how much fat's available. What do you mean? Why would we take more than's necessary?
People just wonder if they're going to get a little liposuction.
Oh, I see what you're saying.
That's what they're asking.
Oh, yeah. People will get a little bit of liposuction. Yeah. I mean, it is liposuction, but the volume that we're harvesting.
Will it make a difference?
It's subtle. I mean, if there's a specific troublesome spot that you want us to use as the harvesting site, we're happy to use that site. But really, we're not doing it for body sculpting. We're using it really for grafting purposes.
Right.
So, in fact, we like to take it from multiple body sites so that we don't cause any dimpling, depressions, or asymmetries from areas.
That's what I was going to ask you. Does it cause atrophy at all?
It can. It's not so much atrophy, but just you've removed some fat, and if you take it in one say you took it out of one side of the abdomen,
Yeah.
not the other, you may find that one's
One
a little
oblique
bit,
is going to look really good.
yeah, one will look a little bit more defined than the other. So you have to take all these into consideration from the donor site.
Okay, another
But
question.
we wouldn't take hundreds of
No.
cc's and use
So you're
10.
not getting liposuction, everybody. You're just getting enough to address the face. Okay, another question. So let's say you're taking some fat from the abdomen and you're putting it in the face, and then the person gains a little bit of weight. What happens? Does that fat cell grow? Is it lumpy?
Well, it's two separate issues. The lumpiness has more to do with the fat quality and whether the fat's being put through sort of a filter, basically. So if you're injecting big, thick globules of fat, it may be lumpy. If the fat's injected close to the surface, it may be palpable or lumpy. If it's injected and it's smooth and it's deep and you gain weight, then you may gain a little bit of weight in that body part because you have got fat that's alive and it's going to be gaining a bit of weight. But if it's placed appropriately and deep, it's unlikely it's going to cause you any significant harm. I mean, we don't want to do fat grafting on patients who are going to be fluctuating in weight, like huge, massive weight changes over time.
So is the fat quality from the abdomen the same as the fat quality in, let's say, the buccal pad or in the neck, where we can sometimes take neck liposuction?
They're all a little bit different. You know, eyelid fat itself is a little bit more granular, thicker. It's different. It's almost fibrous, the fat from the eye. The fat from the abdomen and the inner and outer thighs, overall, sort of similar for most patients. It's got a similar sort of quality to it. But it does vary patient to patient. We sometimes take fat and it just looks like really fine and nice. There's other patients that may look chunky and globular. And that's our decision during the procedure to put it through those mechanical shearing type of things where we have little devices to break up the fat. So we use that a lot more and more. So we have devices that allow us to sort of pass it from one syringe to another through a filter process to break up all the globules so that the fat is more homogeneous for injecting.
So we often combine fat grafting with surgery. So we use it for lower eyelid surgery. We use it with facelift surgery. So you reposition the skin, the muscle, but then there could be some deeper lines here that we use the fat for. How do you know how much fat to use? Because the fat can be reabsorbed. It's known for being reabsorbed, 25% can be reabsorbed. So how do you determine how much fat to put in?
Well, it's like anything else. It comes with a little bit of judgment. So we don't want to overcorrect any area. And we like to anticipate that there may be a little bit of fat resorption. So I would say that we typically will correct just up to what we think is 100% correction, anticipating that there may be a little bit of loss. But I don't want to overcorrect under the rare condition that 100% of the fat survives, and then you've got a lump or a distortion. So,
is there any way of dissolving fat?
It's very difficult. You know, we sometimes have patients come see us that have lumps under their skin from fat grafting, and they're asking us for solutions. We sometimes inject cortisone, like Kenalog or 5-FU, anti-inflammatory type products. We have had some patients come to see us who've had injections of dilute Kybella, the product that's used to dissolve fat under the chin. But again, that's an acid, and so it's not 100% predictable. So if someone's had a very severe lump, the option of using dilute Kybella may be a good idea to try. So all those things are potentially options, but for areas like under the eye, you have to be extremely cautious not to over-inject.
I have to say, the fat grafting combination with facelift surgery, I think, is fabulous. I think they go hand in hand. I think they look, it just looks so natural. It looks really good. So in that case, you know, you're talking about when would you use filler, when would you use fat grafting? I think you lean towards fat grafting in combination with facelift surgery, opposed to filler.
Yes. Well, patients who are undergoing surgical intervention, I'd rather use fat for sure. There's many advantages of fat, not just for a augmentation and a filling component, but also it has likely got what we think of as stem cells, which has some anti-aging properties. It seems to improve the skin quality by doing the fat grafting to a given area. So there's some secondary benefits. While the Filler products can be used as a nice sort of volumizer. They're not going to have any of those same properties. Some of these properties we don't fully even understand yet, but it's pretty much universally understood that adding fat to certain areas enhances the overlying skin, may give you more of a youthful glow, doesn't attract water like fillers. So some of the filler products have some negative side effects that they can look a little bit puffy, and water retention can be common, especially under the eyes. So when we're using it under the eyes to correct the hollowing that is part of the natural aging process, fat does have some benefits over filler. That being said, if a patient's already asleep and having a surgical procedure, then the logical thing for me to suggest would be to add fat grafting to the procedure. If someone's not having surgery and they're looking for a non-surgical option, then filler is really your only option.
Okay, so let's say someone's in their 30s and they want, I mean, the stem cells, who wouldn't want that if it's, going to help with anti-aging? Why wouldn't somebody in their 30s want fat grafting over filler? However, if they're anticipating that maybe down the road they're going to do a facelift, maybe it's not the right procedure, because then you're putting fat into position and then it would be repositioned later down the road. So how do you sort of juggle all those different scenarios?
Yeah, it's tricky. Like we this week did a couple of younger patients with fat grafting, but the surgical plan with the fat grafting in a younger patient would be different than an older patient who's already undergoing facelift surgery. So in a younger patient, the tissues are sitting in their optimum position. In the younger patient, their tissues are sitting in their optimum position, and we're using for things like hollowing of the temple, some early changes along the upper lateral cheek, the periorbital area underneath the eye, and the lips. So as they go through the rest of the aging process, putting fat in those areas is not going to really adversely affect them in any way, and it's not going to shift or produce any sort of asymmetries or imperfections that have to be addressed separately. If a patient is older and they're looking for fat grafting as an alternative to facelift surgery, it becomes more complicated. So in certain parts of the face, such as temples, we can do that fat grafting and won't affect the outcome of the facelift, because we're not really moving the temples significantly, or the hollowing of the temples it needs filling either way. Areas like a chin deficiency, sometimes we usually use facial implants or chin implant, but the odd patient will request fat grafting to the chin for very subtle volumization of the chin soft tissue.
How about the jawline? Can you do it along there?
Yeah, you can use it as a volumizer anywhere. But if someone's needs a facelift and you start enhancing their jawline with fat, and then you go to a facelift, you're going to be moving tissues from an area that they probably shouldn't have the fat. So you may be distorting the anatomy a little bit. So you have to take that into consideration if the patient's planning a future facelift. So it's better to do at the same time as a facelift if a patient needs tissue repositioning.
So would your recommendation be for women in their 30s, filler, and then consider fat grafting later down the road?
Depending on what areas they're looking at. I think my preference would be fat grafting for things like lips, and periorbital areas, maybe temples, if they're open to it when they're younger. If they're not interested in a surgical procedure, then certainly filler is a good option for those types of enhancements. Filler is still the most common volumizer in the world because it's available. It has a high safety profile for most cases. I mean, there's risks with both of these things, but overall it has a relatively high safety profile. It is dissolvable, so for patients who are not really sure of exactly what the modification is going to do and if they're going to be satisfied or happy with it, filler's got some advantages in that it's largely reversible.
What's the equation for knowing if somebody's got enough fat? If you pinch an inch, how do you, because there's a lot of patients are in shape. There are people who come to us care about how they look and they're in shape. So not everybody has some excess fat. So what would you do for a facelift patient, for example, who really wants fat grafting and doesn't have the fat?
Well, sometimes we tell patients, we'll see what we're able to harvest. I can't even tell always. I mean, most patients who are like extremely lean, marathon runners, people who work out every day, very lean females may not have a lot of fat in their abdomen area, but usually we're able to get some from their lateral thighs. So it'd be rare for us to not be able to get any fat. Now, we may not get a ton of fat, but usually we're able to get enough for things like eyelid rejuvenation.
So bottom line, fat versus filler, What's your preference?
I think the purely aesthetic outcomes achieved with fat grafting, I think, are superior and appear more natural, but it is a surgical intervention. It is not easy to reverse. Frequently, patients who seek out fat grafting have already tried filler and like the results, and they're looking for a more long-term solution. So I wouldn't say one over the other. I think it really just depends on your circumstances. But if a patient's open-minded to surgery, they say have tried filler, or they really know they want to augment a certain area at the same time of, for instance, eyelid rejuvenation, fat grafting we do all the time. It would be my preference, way over filler under the eyes because it doesn't suck onto water.
And it can be done under local anesthesia or IV sedation or general anesthesia if patients wanted it.
Yeah, yeah.
Okay, so let's get to the bottom line. Which do you prefer for particular facial features? And I'm going to go through the list. Fat or filler, temples?
I would say equal, but fat if the patient wants long-term results. Filler if patient's younger and not ready for a surgical procedure.
Tear troughs under the eyes?
Fat.
That was a fast answer.
Well, you said preference, so my preference would be fat.
That's great. That's what I want.
And the reason is I think it can give a more natural long-term result for,
I think it does
for
too.
hollow. I think that it doesn't hold on to water, and there will not be the telltale sign of some patients with filler, which is known as a Tyndall effect and puffiness.
Yeah. Okay, cheeks.
Again, either depending on patient's age, demographic, whether they want reversible or irreversible, long-term, short-term. So either.
Was that an answer? Oh, it was either.
It's an answer.
Okay.
I'm saying either,
Okay.
but my
Okay.
reasoning behind either for that one. But if the patient's willing to do surgery, I think fat would be a longer-term solution.
Okay, nasolabial folds.
Again, I think fat provides long-term better augmentation of that area than filler, but I think both are good options.
Okay, lips.
Fat.
That was a fast answer. Okay, why?
Well, one is long-term results with fat grafting versus filler. I also think that the filler has a tendency to look really good, but can migrate from the lips.
Can fat not migrate?
Less so. And
That's really good to know.
And water retention is also an issue where lips may look different. They may look beautiful on the table, may look good for 6 to 12 months, but then often they'll deflate, but the filler hasn't gone away. It may have migrated into the upper white lip, causing what's known as a white lip mustache.
Can you get the duck lip though with fat grafting?
Yeah, yeah.
You still can?
The techniques are similar. The artistry of it, of where to inject, is very similar. I just think that with the fat grafting, they also feel softer. They feel like more natural. The injected lips feel nice and feel soft, but they don't feel 100% natural. They may feel a little bit more rigid or stiff. I don't know if that's your experience, but that's generally.
Yeah, I would have said the word stiff.
A little bit more stiff.
I would have. I just gave away that I might have some in my lips. Okay, chin.
Chin, I would say filler or chin implant, and I'd say fat's probably the third most common product that we use. And usually we use it out of convenience because we have some extra fat, and it's an area of deficiency that a patient may want augmented at the same time, but it wouldn't be the top choice for the chin augmentation. The reason is you're putting in a soft product in the fibromuscular layers of the chin, or sometimes even deep to that, rather than augmenting the actual bone, which would be a genioplasty or a chin implant, where you're adding something in the deepest layers, which I think seem to give the most natural results.
Okay, fat or filler in the jawline.
Depends on the patient's age. I think that jawline filler is it's a cool procedure. It can create some nice shapes, but again, I find that it may look a little doughy and soft over time and not look as sharp and as defined as it did at the beginning when it was first injected. Fat grafting that area, similarly, I find you're putting a soft structure over a hard structure. It certainly can be done for facial augmentation, but it wouldn't be my first choice for any of those. A little bit in the pre-gel sulcus if someone's got a hollow, if they're already doing a facelift procedure. And if you lift the face and you find there's a tiny deficiency in front of the previous gel, which can happen with age, a little bit of fat in that area is a nice thing to add. But I think both of those products have limitations along the jawline.
Okay, last one. You can put filler in the nose for injection rhinoplasty. Can you put fat in the nose?
Fat injection on the nose has been done by many surgeons worldwide. It is something that is available. It can be used in conjunction with surgery. For instance, in patients who've had multiple rhinoplasties, and if the skin starts to take on some changes that are not favorable or look unnatural, such as scar tissue or tethering or tightness, microfat droplets can be injected to improve the skin quality as well. That being said, there have been reports of patient blindness with both injection rhinoplasty and fat grafting to the nose, just due to the anatomy and the overlapping blood vessels to the orbit in the nose. It's probably less than 1 in 1,000 or 1 in 10,000 chance of you actually having an adverse outcome from it. But with filler, you can at least intervene and attempt to dissolve it. With fat grafting, if you get an embolus from it, it's catastrophic and hard to reverse. And the nose is, for whatever reason, one area of the body where it may be riskier to do fat grafting.
Wow. Okay. So you must go to a good surgeon if you're choosing to do fat grafting in the nose or anywhere else. Let's go back to the beginning where you touched on filler use and that it's down in the last few years. There's statistics showing that it's not as commonly being used. Why would that be?
So it's a great question, and I think a lot of people are trying to figure it out. The industry reps that we talk to all the time that come to our offices that sell us the products have indicated that there's a trend where the injectable filler market seems a little bit dead. So we don't know if it's due to the economy. Some people are theorizing that the product's almost too good, it lasts too long. So we used to sell the product saying it lasts 4 months, whereas now we're finding people get their lips done and it lasts for a few years. So patients may love it. It's not necessarily an indication of a problem with the product, but it may be just that the product's almost too good and lasting longer than we anticipated.
Do you find when you're doing a facelift that you can see anybody's filler that was injected long ago?
Yeah, we see it all the time. We ask
Right.
patients if they had filler, and we usually dissolve it before facelifts. But some people say, I haven't had filler for over 10 years, and we get in there and we find some filler.
So the proof is in the pudding.
Yeah, no, definitely the product definitely lingers and lasts. And in a way, it's good. If it migrates and changes and doesn't do the same type of, the physical properties of the product may not be as robust as they were when they were initially injected, but the product may still be doing something. Whether that something's overall good for your aesthetics or neutral for your aesthetics or bad for your aesthetics, that's the issue that we're trying to figure out. It may make you look just a bit puffed out rather than lifted as it did when you first had it injected. So I think that's a major factor. And the third factor is that some people, like any product, it may have been overdone. So the product became so popular, so widespread. There's great injectors, but there's been like a low barrier to entry, meaning that the product's been injected all over the place. Mean there may be less skilled or trained injectors. There's just the theory. And as a result, you may have people like not liking the result, and therefore the whole market takes a bit of a hit because you're seeing
Or
people,
over-injecting.
Yeah,
Just
that's
continuing
what I mean.
to say yes to patients who keep asking, and then they look puffy.
Right. So the puffiness. And then again, it goes to pop culture, what we see in the media. And then there's all sorts of blogs that are out there where, some people may be noticing these trends and, criticizing filler, saying, oh, so-and-so looks terrible, she had too much filler. And then, that can potentially have impact. The online voices of certain bloggers is quite significant. And so I understand that there's been some people who've been anti-filler crusading out there that have potentially affected the market as well. But it's hard to know exactly why. But filler statistics are down a bit. I think it's multifactorial, all the things that we talked about. That being said, I think filler is certainly not going anywhere. It's a huge industry. It serves its place in the industry for anti-aging and aesthetic medicine. It has great applications in many ways when used on the right patient, right indication,
The right amount.
right amount, right injector. It's a wonderful thing to utilize as part of the anti-aging aesthetic industry. So not anti-filler at all. Just want to make sure that people are aware.
Anti-filler.
Yeah, I'm not anti-filler, exactly. Anyway, so I think that's a wrap. We covered filler, fat grafting extensively today, the pros, cons, some trends in the industry, the differences between the filler and the fat grafting, and how, at least in my practice, I tend to choose one over the other. And hopefully you found that informative. And we will see you back shortly for another episode of Unfiltered.